So strangulation, ileus, so what is it caused by? It can be caused by, of course, torsion, so twisting of the stomach. Volvulus is the same thing, so you can say either of those. Incarcerated hernias and intussusception, so one part of the gastrointestinal tract goes into the other, or just say the digestive system. And basically what this does is it reduces blood flow to the area. So yeah, it's mentioning the four etiologies here. It reduces blood flow to the area and it causes ischemia, so basically lack of oxygen. So you can imagine like just twisting these, the blood vessels are compressed. So yeah, if we're talking about volvulus and torsion, what volvulus is internal twisting, which leads to obstruction, whereas torsion is internal twisting only at the mesentery root. So I was wrong, they're not literally the same. Torsion is only at the mesentery root. I don't know how to remember that, I'm sorry. So yeah, this is usually caused because the dog has eaten something dodgy, they've exercised too much, usually after eating, trauma to the abdomen, operations, as we mentioned with adynamic ileus, enteritis, so another infection, and these can occur because of a number of diseases like parasites. One that comes to mind is parvovirus as well, foreign objects, and of course we mentioned intussusception. So the kind of clinical signs you'll see is like they might be close to death within a few hours. Suddenly they'll be in pain, they might be in shock. What are the signs of shock? Always think heart rate increases, CRT increases, pale mucous membranes, and a weak pulse. Always these four things. So pulse, heart rate, mucous membrane, CRT. You'll see mild abdominal enlargement, so distension, acute nausea, vomiting, depression. They're very weak and they lie down a lot. And look at that color, it's not good. So yeah, we usually diagnose it by palpating. You'll see pain as a response to that, and you might even detect these intestinal loops because they're so distended. And you might also find abdominal fluid if you do abdominocentesis, although I don't think I'd recommend it because it could lead to peritonitis, I think. So an x-ray as well, what you'll see internally is it will look radiolucent, so you can see this is just full of air. Yeah, because it's got radiolucent gas in it. And you'll treat the shock basically using fluids, for the electrolytes, hydration, antibiotics, of course, to treat any infection. Surgically, you would also cut open the diseased intestine. So for example, here, we would get rid of this very dark, dodgy looking intestine here and use analgesics post-op as well, because of course it's a very painful procedure, intussusception anywhere. Let's see. Okay, there we go. Okay, this is a very good picture, I think. Anyway, so intussusception is where you have an internal segment invaginating into the adjacent segment's lumen. So you can see, for example, this is going into this. That is not normal. And basically it's caused again by infections leading to enteritis, so intestine infection, parasites, dietary indiscretion, and foreign objects. So the etiologies are volvulus, torsion. Remember, torsion is only at the mesentery root when it's volvulus, when it's twisted, sorry. Sorry, I lost my train of thought. But yeah, the clinical signs are the same as intussusception. Volvulus, torsion, and intussusception have the same clinical signs. So abdominal signs, intermittent diarrhea, depression, they don't eat, and they lose their body condition. So the diagnosis is, you'll hear that they might have had a recent operation, maybe a change of environment causes stress, maybe even changes their diet. You'll palpate longer, thick intestinal loops. So even the diagnosis is very similar. But I'll say the severity of the clinical signs and the clinical signs themselves depend on the location of the intussusception. So it might not always be, you know, let's say for example, I don't know, jejunal, for example. I'm just saying something random. And the duration of the internal obstruction, the x-ray can also be hard because if there isn't a lot of gas, you need a barium enema. So, you know, because it's the intestines, you'll have to give the barium the other way around through the anus. And an ultrasound will show fluid accumulation, which is hypoechoic, so dark. And this is the best way to diagnose it, if I'm honest. I think there's a picture here. Ultrasound, please. Yeah, so this is an example of the barium enema. Yeah, so you'll see the ultrasound is hypoechoic where the loops are because they're full of gas and they're quite dark. And you can see here it's just plainly obvious. So yeah, what else was I saying? You can do a colonoscopy, so put a camera in the bottom. Also, you'll see that they're dehydrated, lack of electrolytes, the pH is abnormal, and also the poo, if it's a parasitic infection, will have parasites. So yeah, you can treat the disease with, of course, fluids with electrolytes and the correct pH. An operation, you can do a biopsy to determine the etiology. So for example, yeah, parasites is a good example. You can use opioids like butorphanol to decrease the recurrence of intussusception because there'll be less motility of that area. Antibiotics to treat the disease, and an enterostomy tube can also help with nutrition. So this is just a tube we put into the intestine to feed the animal.